Hello, I'm Dr. Adam London, Director of the Kent County Health Department. And in this moment, we're very concerned about the older population here in Kent County. We've been told, of course, that people over the age of 60 are more vulnerable to the COVID-19 virus. We also know that that older population is more likely to be isolated and be lonely. I'm joined again by Kristin Spykerman, the Chief Clinical Officer at Network 180. Kristin, can you first of all talk to us about, is this something we should be worried about? Are our older population more likely to suffer from behavioral and mental health issues overall? And should we be worried about that during this situation?
Yeah, Adam, our older population is more vulnerable to depression and anxiety, especially in a situation like this where they are isolated from the rest of society. Not only do they have the fear and anxiety that they are some of the most vulnerable in terms of the disease itself, but also that they aren't able to engage in activities that maybe they were able to engage in before. Even going to the grocery store can be something that's incredibly anxiety provoking because of the threat that's out there to them. One of the things older adults can do is to try to connect as much as possible with friends, loved ones, whether it's over the phone, whether it's over social media, FaceTime if that's available, so that they can FaceTime with grandkids, with loved ones, with siblings, sons and daughters, so that they actually can see somebody in person, so to speak,
right.
Versus being stuck at home. I think distraction is also a good technique. I wouldn't recommend distracting yourself with the news right now, because that is something that can cause even more anxiety the more we watch the news. So to be informed is important, but not to be obsessed over the news as well. So take a break, get outside, sit on a front porch, take a walk if that's something that older adults are able to do. Try to keep to some sort of schedule as much as possible. And reach out for help. So let others know what you need.
Yeah, that's critically important, the willingness to be able to say, I need help. And I'm reminded of all of the studies that we've seen that show that social interaction is so important for the health of all of us, but especially for our older population. And that's something that we're specifically being told to avoid right now.
Mm-hmm.
What can the rest of us do that aren't in that age group to support them right now? You mentioned using the video and the technology to try to reach out to them. Are there other things that we should be looking for that we can do to support the health of our older neighbors?
Absolutely. As we are reaching out, I think it's important to ask our older neighbors and relatives how they're doing. How is their mental health? Are they depressed? Are they experiencing anxiety? So check in with them. It's important to reach out to those who aren't able to get to the store, for example. So for older adults who are really isolated, can you as a neighbor pick up things for them at the store if they need things? We can get our kids involved. So if your kids have some sidewalk chalk, they can draw a picture for an older neighbor on their sidewalk or on their driveway. If not, they can draw pictures and post them on their doors, write notes to older neighbors. That helps get all of us involved in trying to help and be part of the solution, and can help adults and kids with their own mental health as well.
Great idea. Thanks, Kristin. And let's be creative. Let's try to find ways that we can engage and interact with the older people in our community to make sure that they're getting the support and they feel the love that we all have for them as well. Thanks for watching this video. I'm Dr. Adam London, Kent County Health Department. Please continue to like and share these Facebook videos. Thank you.